Tears to the biceps tendon may require surgical intervention to secure the tendon back in place. An incision is usually made at the front of the elbow. Sometimes 2 incisions are required. The tendon is repaired by removing excess tissue and placing threads through the end. A channel through the bone is created. The tendon is then secured through this channel. The skin is then closed with sutures or skin staples. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you've understood everything.